The first symptom of pregnancy is the delay of the menstruation. If you're not having the period on time, you should have a pregnancy test. Either you have it at home with a urine test, or you can go to a clinic to have a blood test. At blood test, HCG hormone positivity shows that you are pregnant. But if you're having a urine test, it can be misleading. In some women, like 15%, even if the urine test is negative, you can be pregnant. So you need to repeat the test 1 week later. Even if you're not having the menstruation after the repeating of the test, then you should do a blood test, or you should visit a gynecologist to be sure that you are not pregnant. There are different causes of delay of menstruation, delay of period. If pregnancy is not one of them, the other causes has to be examined by transvaginal ultrasound and by some hormonal tests and some biological parameters. If the pregnancy test is positive, this means that you're at 4 weeks of pregnancy, because the pregnancy is calculated from starting from the first day of the period, and the pregnancy ends usually at 40 weeks of pregnancy. The time you're pregnant, the time you learn that you're pregnant is 4 weeks. At the ultrasound at 4 weeks, there is no any visible sign of pregnancy. The only thing the doctor sees is that thickness of the endometrium. In order to see the gestational sac, the baby occurring in the uterus, you have to wait up to 5 weeks. At 6 weeks of pregnancy, 1 week later, you will see the embryo with a positive fetal heartbeat. This means that your baby is healthy and everything is okay. But if these are not visible at these times of pregnancy, the doctor will tell you about more what the problem is. And the major risk in this kind of women is the risk of ectopic pregnancy, which is very risky for the mother because of the abdominal bleeding risk. So in every pregnant woman, the ultrasound needs to be checked to see the babies. Every woman needs to visit a gynecologist as soon as possible after they learn that they are pregnant, to see that there is a healthy fetus inside the uterus and the location of the pregnancy is correct.